First of all, I would like to ask for your permission for both of you to use this video for educational purpose and on internet.
Yes.
Thank you very much. Now tell me, what were your symptoms before the surgery?
A lot of pain, mostly in the nerves on the left side, and it would come around
Around the
this
chest?
way. Yeah,
Both sides or just the left side?
just the left.
Just the left
And
side.
it was pretty sharp pain.
Okay, 1 to 10, how bad was that pain?
Oh, it'd be anywhere from 4 to 10.
4 to 10. And I remember we did investigate it. We found out that is a problem of the bad disc that's coming and causing some compression on the nerve. And then we decided to do the surgery. The surgery was just about a month ago,
Yeah.
correct? First of all, how did you feel right after the surgery?
I felt pretty good.
How bad was the pain
But-
that you had turning around the chest right after the surgery?
That was gone.
That was gone right after the
Right,
surgery.
Yes.
How long after the surgery did you walk?
Probably just a matter of hours. They
Hours?
had me up and walking a little bit
And when did you go home?
the next day.
And how do you think that was turning around the
That's
chest?
gone.
Excellent, excellent. Now, how long before the surgery did you have that pain that was going around the chest in that manner?
It started like right after Christmas, so good 3 months.
Okay, okay. Now I'm going to turn here and look at this film with you. Here is the what we call down view, and these are the screws that are in a good position, and that's a spacer here that keep the space open here, and this separating the bone there actually release the pressure of the nerve. And 46 minutes, and our blood loss was 33 cc, and we did T9, 10, what we call MIS DTIF, that procedure. It seems that procedure has worked for you pretty well.
Yes.
Excellent.
Yes, I'm happy with it.
Excellent. Any comment, anything else? How's your daily life? Are you back to your regular daily life?
Getting there, but not quite. I'm still not bending down. He has
Oh,
to-
and you shouldn't be doing
No.
bending. Bending is not good for you.
No,
And
I classify my wife as a BLT, no bending, no lifting, no twisting.
not the sandwich.
Yes.
But
Well,
it gets better every day. It seems like I'm able to do a little bit more. each
excellent,
day.
excellent. Well, thank you for the interview.